Turning to Chapter 7, we're going to look at speech, language, and communication with regard to the diagnosis of ASD. Obviously, there's a strong relationship between what we're speaking about with social interactions and language and communication, so you'll see a bit of overlap. Just as a review of the domains of communication to qualify those terms that so often go together in speech, language, and communication. Language, of course, is that rule-based system that everyone speaking that language understands in order to function as a communicative device. And so how we put our words together and what allows us to convey the meaning we intend and understand the meaning of others. Speech is actually the production of sound, obviously, and then communication is the big term that covers all the forms of sending and receiving information. So, verbal, nonverbal, written, all of those types of message providing devices. The communicative aspects of very young children, what we're really trying to do when we first begin to attempt to communicate, can be looked at in measurable ways differently. So if we're trying to get a handle on how well a very young child is communicating, the types of things that we can observe and actually collect data on would be things like the frequency of communication, how often there's an attempt, what is the function of it, why is the attempt being made, how is it being made, what is the means of that communication. And then turning it the other way, the responsiveness to the communication of others. So the first three are more expressive and the last more receptive types of communication. There are developmental benchmarks for the frequency of communication in extremely young children. So for an example, it might be typical benchmark for a 12-month-old to embark on some type of communication, twice in a minute. And so there are many observational tools to look at this. Some are informal, others are published. Some of you chose to use data collection forms for your last assignment with regard to communication. And so data can be collected very early on. As far as the function goes, whether it's proto-imperative or proto-declarative, whether you're trying to regulate what someone else is doing or create just an interaction, this is seen in very young children as well. So by the time children are a year and a half, they typically have the ability to perform both of these functions. Obviously, with all developmental types of skills, the communicative functions become more advanced and developed as the children age. But children with ASD exhibit a limited range of these behaviors. So they begin not to meet the typical benchmarks. And there's good information throughout this chapter. I will refer you now to 174, 175 for some more specific examples around what the benchmarks might be and where you might see children with ASD ranging within those. So obviously before speech, it's typical for infants to babble, but they very soon start to use conventional gestures earlier than most people would expect if we're not really paying attention to it. So very young children will do things like point with a meaning behind it. A child with ASD can try to communicate using gestures, but very often they're non-conventional. So back to this interpretation of many of the social aspects of communication that we tapped into on that very brief discussion of theory of the mind. Very early on, we may see a lack of convention in the attempts made to communicate by very young children with ASD. Also, the responsiveness to the communication of others may be atypical. So it's very often noted that children with ASD don't always respond to having their name called. Most children will turn and look at the person who's called their name. And most children have a receptive vocabulary of about 50 words early on, when children with ASD do not have those numbers continue to grow. However, these particular types of difficulties are not experienced by all children with ASD, and we all know that very high functioning and communicative folks with ASD have much more subtle communication difficulties than these very typical benchmarks. There's good information again in your book, and a good table on 179 that gives you insight into some of the standardized instruments, and some of them you've seen already. But you can observe children in multiple settings and record all different types of intention behind their communications and how they elicit communication in order to get that data recorded. In other words, the folks doing the assessment set up situations that strongly invite the child to communicate in different ways so that they can be measured. So they may give them scenarios, they may hide a toy. There are many different ways to elicit communication in order to then get some sort of measurement. The language forms and the meanings of them with regard to folks with ASD, what we see are differences in responsiveness again, how the child might respond, be it atypical or the lack of response at all to a communication. Most people are familiar with echolalia and the repeating of words or phrases perhaps, and it may be delayed, it may be immediate, but it is one of the more classic characteristics of some folks on the spectrum. Also often seen is a use of pronouns that is atypical, incorrect, using me instead of you, confusing I, me, you, all pronouns basically, and the confusion that leads to obviously in communication. And then also some atypical formulation of sentences and use of vocabulary. So using maybe synonyms, maybe words related even less directly in replacement for vocabulary, and also using unique syntax. So the order of words in a sentence may be atypical. We talk a lot about pragmatics with folks on the spectrum because that is the more subtle, complex, abstract kind of level of communication that often causes folks on the spectrum a great deal of difficulty. But it applies to the use of language in many ways. So that those subtle ideas of when it's your turn to speak, and when you're inviting someone else to speak, and how to offer greetings and initiate social kinds of conversation, keep a topic going, maintain a conversation in a comfortable manner, changing topics appropriately. So the lack of these pragmatic abilities is what provides a lot of awkward kinds of behaviors around communication of even very high functioning folks with ASD. Specifically assessing the communication skills of high functioning speakers has been addressed more and more with the broadened spectrum. There are many norm referenced instruments now that really look at pragmatics specifically, and also look at the patterns of speech as far as intonation and stressing the right syllables, sounding fluent and conversational, being able to carry on both a conversation and have narrative skills to describe or tell a story, or have things make sense in a communication way to anyone listening, can also be assessed using these instruments. For nonverbal children on the spectrum, and back in the day, many children identified with ASD proportionally were nonverbal. That numbers decreased so much with the broadened spectrum. But for those children, there's always the assessment in order to determine what kind of augmentative communication devices might be helpful and necessary. In order to make choices around augmentative communication. There has to be a look at the person's intellectual abilities, cognitive abilities, their basic linguistic abilities to begin with, to match those up. Is the person functioning at a pre-intentional stage, meaning, there's no, despite their being nonverbal, there's also no intention behind any of their communicative behaviors that we can identify. Are they pre-symbolic? Are they going to be able to, take a device with words or pictures and use it effectively? Are they at the pre-literate stage or literate stage? And matching then that level of skill to the device that they use. So some of our augmentative communication devices are extremely sophisticated in the language that's used. So it's merely an assessment that attempts to match the level of sophistication in language to the person who will then use that device to communicate. And then also something that needs to be considered more and more are the multicultural considerations with regard to the diagnosis of ASD, and then planning for an individual with ASD who in our culture would have English as a second language and cultural differences as well. It hasn't been addressed a lot in the research, but it's beginning to be much, much more. And there have been a few tools developed to try to consider the cultural differences in communication, again, as not to confuse differences from disability. And this is such a difficult thing to do with any of the evaluations of folks suspected of having disabilities, if there are language and cultural differences to begin with. So how do we make that distinction between what is different and what is in fact part of a disability?